Introducing the new Klarity BiteLok. The Klarity BiteLok comes as a complete package with the following components: the BiteLok mouthpiece, 2 putty packets, a quick fit tool, long and short tongue depressors, right and left tongue diverters, and a tongue device removal tool. To begin, determine the placement of the BiteLok in the patient's mouth. Insert the tongue device attachment if you are using one, and test for placement. Tear or cut the putty packet open and squeeze the contents out. Mix the blue and white putty together for 15 to 20 seconds until thoroughly mixed. Then, roll into a cylinder and wrap securely around the bite area of the BiteLok mouthpiece. Place the BiteLok mouthpiece back in your patient's mouth and have them bite gently into the putty for 2 minutes until the putty hardens. Once the putty has become firm, make your mask as usual over the patient and the BiteLok. While the mask is still warm, use your hands or the quick fit tool to index the mask to the BiteLok. Once your mask has cooled, you can remove the mask with the BiteLok and quick fit tools still attached. Leave the BiteLok in the mask for 12 hours until the mask has fully cured. At that point, you can remove the quick fit tool and the BiteLok from the mask for cleaning. The BiteLok can easily be reinserted into the mask for treatment. Learn more at www.claritymedical.com/BiteLok.